later joined the pediatric training program in West Yorkshire Deanery in the UK, with a strong research background and several publications in pediatric endocrinology. She serves an EC member of MRCPCH and co-leading the Child Health Office. She earned a clinical education diploma from the University of Edinburgh and completed her master's degree in pediatric child health at University of Leeds. Let's all welcome Mai. Mai, the floor is yours.
Thank you very much, Sarah, for this nice introduction. I don't know if you can see my slides in the form of slideshow in the moment.
Yeah.
Wonderful. Okay, so good afternoon, everybody. My name is May, as Sarah just mentioned, and without further ado, we're just gonna get in and jump into the topic just to make use of the time and have further scenarios. So what I'm wanting to talk about today is about the communication skills for MRCPCH. So the objectives of our talk today is basically to know the general rules in any communication station. So what are the ABCs to excel any communication scenario, whatever the topic of the scenario is. Looking at the sessions or the communication stations in the previous years wasn't really quite involved because I cleared my clinical examinations in 2014, so that's quite like a good time already. But in general, looking at the websites and just checking what sort from my colleagues of comment stations are going on, it looks like I gathered there are 7 communist stations, which are usually the exam is revolving around. After discussing the rules in each of those, we'll get some scenarios just as our time would allow, and we'll ask some participants to join in. These are my disclosures. These are where I got my information and based them on. So communication station in general, we've got 2 stations in an exam. That was the rule, unless it's newly changed. 9 minutes for each station. We've got a preparation station of 4 minutes before each of the communication scenarios. The common stations are information giving, breaking bad news, conflict resolution, medical error, management and treatment issue, and by that I mean escalation of treatment if the child is deteriorating, or discussing a specific management plan which the parents or a teenage child, for example, or a child is having a capacity is not happy or not agreeing with. Teaching a colleague and supervision issues, as with your colleagues as well. This is now starting to come more in latest exams. So general principles. I tried to find the mnemonic for this rules, but unfortunately I really failed. I'm sure you guys could definitely gather together and just put on some word to remind you about these rules. Each of us got a different brain and way of thinking, so we definitely get to process this differently, but it's easy just to remember that you've got those 6 points in each of the scenarios when it comes to a communication station. Introduce yourself. That's number 1, no matter what. Introducing yourself with your name, or introducing yourself to a colleague that you already know, or to a parent that you met before, would have a bit of a different formula or template. But as far as you introducing yourself and saying hi at the beginning, that's really important, and just mentioning your role as well as your name. Preparing the scene. So by preparing the scene, I subdivided into 3 settings, and I know that is how my brain works. Look, see what you think. You might not need to do all those, but it really helps me to stay still and to know what I'm saying in any scenario. I can always manipulate it according to the scenario. So I always like to start the scene by saying, we'll try to keep that very, I will try to keep this time very dedicated to you, no interruptions. If it was a face-to-face scenario, I would say I'm keeping my, for example, my mobile off. I'm asking the nurse not to get into the room during this time, or no interruptions. You can do that in a virtual session as much as you can, actually. Ask for if the parent or the patient, sometimes if they're teenagers, if they need any support, if they need any environment, any like emotional support around with them before starting, especially in scenarios of breaking bad news, but we'll delve into that in the coming minutes. Mention the purpose of the talk. Well, guys, this is really important and we sometimes just ignore it. That's why we need to have this structure. We need really to be very clear in mentioning what are we going to talk about in the coming minutes, because that's really easy to get missed, especially if you start getting the parents or the patients into board before explaining yourself further. All right, so going to the third point, we've got recapping, and by that I mean asking the parent or the patient about the information about specific topic. So don't get into it before knowing what do they already know. They might surprise you by actually knowing everything and needing only one single information. And then you start digging and hitting around the bush here and there, spending your 7 minutes talking about nonsense. When it comes to the last few minutes, you know that they actually know, or let's say he's actually a neurologist who knew everything about seizure. So please don't get yourself into this point. Just ask them, what do they know? It would be nice to know where did they get it from? Because some of the parents would tell you, well, the mum would say, I've got my sister who's having diabetes, and therefore I've got loads of things. Actually, I'm helping her with her injections, or actually I'm reminding my mother about her tablets, about her metformin tablets or so. So that would make life easier. Therefore, asking them what they know, where they get it from, and what do they want to know in these few minutes is very important. You can that's again, this point it's not really necessary to be done. You can leave it later, but I'd also again like to say it earlier, just to make sure that it's out of my mind. And that's inviting parents to get you to interrupt you and to ask you in the middle of your information delivery. Just make sure that you're not ignoring that bit, you know, and you tick the box for it, that you are allowing parents into your conversation. Preparing for breaking into chunks. So that's only applied sometimes when you, let's say, talking about really large and broad topic, then you want to say to the parents that you know, that's really going to be a massive topic to talk about in one session or in few minutes. I would then like to talk about certain thing today, or I'll give you just a general idea today, and we will always have a time to talk about it more later. Deliver information. Sorry, that starts again from 1, 2, 3, but that meant to be 4. And that's when you actually start to get in and start saying what you got. You can do that in a very nice way. Just be mindful that that's not where you tick all the boxes, and that's when not what the examiners really want to check. They want, you can say only few sentences, and that's what they need. You don't really need to say like an essay. You don't need to say as much as you want. So don't spend all your minutes in delivering information. You'd rather prepare the scene, understand what they want, and reiterating only the few sentences that you mentioned, rather than spending all the time just giving them and just like stuffing them with information that they would not understand, and the examiner's not really caring about it. Okay, reiterating and checking understanding. So after saying this few sentences that you already prepared them for, just make sure that they're following up. A nice way to do that is asking them to say it back. Sometimes with the heat of the moment, you might just not really find yourself in the mood to ask them to say it, and just start like regurgitating whatever you say, which is also brilliant, not problem. As far as you make sure that you stand your grounds and you have a point, you mentioned it, you reiterate it, and everybody is aware of this point. So that's the point of the day. Okay, check understanding. That is also, I mentioned it again here, just to make sure that After we prepare the scene, after we recap and know what parents are aware, we ask them to interrupt us. We start delivering information, make sure they understand it, and ask them again, do you got any further questions? All right. Last thing is just wrapping up and summarizing. So after all that, you can say like only in one sentence. You don't really need to say just a summary and then say everything, because you might not have enough time. You might just say, so in today's session, we talk about blah, blah, or just like a general idea about seizures or cystic fibrosis or whatever. And then, you know, we can always meet back again, either myself or my consultant in another session. So you need to offer another meetings. And again, according to the scenario, and you can always, it's always nice to signpost. You can tell them, and I will give you, and I'm having some leaflets to provide you just after this session. And I'm going to give you, to hand you out some leaflets to read about just as a preparation for more questions in the upcoming sessions, okay? This is the busiest slides. We'll go now and see the others. I just find it helpful to put some things, some hints to look at and not to look at. So what to do? In general, you need to listen actively throughout the simulator's words, okay? Don't miss a word, because that could mean really loads of things. Don't worry if they speak quick or something, you could always ask them to say that again. Don't get like intimidated or anything. Listen actively, okay? So the other thing, take time to put them in ease and to prepare them, specifically in breaking bad news. We'll come to that later, but don't hurry up to get into the time. Don't worry about the time. You need to fulfill your skills rather than the information. Be careful about words used. Well, that's something that you could do with good practice. And then the thing that I would say, don't use words like you know, harsh words. We Arab could actually be a bit harsh in our way of talking. And we don't feel that because we don't really mean it. It's like, you know, when you're saying, do you understand? Well, it's nice. You really want to check their understanding, but you could have said, are you following up? Is that clear? Is that okay? Shall we carry on? These are nicer ways to say it. Are you listening? Are you listening is quite abrupt, honestly, and I really feel intimidated when somebody says to me, are you listening? Because I always feel that I'm not listening and they just want to grab me there. So yeah, it's nice always to ask in a nice way. It's all polite. Don't worry about that. It's just about it being less abrupt, if that makes sense. Advocate supported environment. Well, that's something, as in, if you follow the structure, you would find yourself not forgetting it. It's always nice in part of the preparation, number 2, to ask them if you want someone around with you. Okay. Be honest, specifically in medical errors and in what is it called, resolutions, in conflict resolution scenarios. Try to be honest and transparent, not pointing fingers and not blaming. You're not in a blaming environment. Try to advocate against that. Even in, like, for example, supervision scenarios, don't try to say, people are saying that about you, my colleagues, blah, 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 are saying that, the supervisor, the consultant are saying that about. No, just say, just as in general, we noticed that that's happening. We really want to help you here. So try to be less confrontational, if that makes sense, okay? If errors, yeah, that's what we mentioned. In medical error scenarios, just try to be transparent as much as you can. You're not hiding anything, and we are not in an environment of hiding. The opposite way around is just the other things which I already mentioned. In general, I just mentioned the last point in don't do. Try not to adopt a way of saying, of blaming things into work, because in real life that will just come against you, will come back against you. So don't do that. Don't say, I didn't manage to do that, or this medical error happens because we are having loads of patients and we are understaffed, and this is your logistic issues that you need to sort with your department. The patient got nothing to do with it. Okay, so don't try to throw and blame that to explain the medical errors. In general, it's not enough. It doesn't look nice when you do that. Okay, let's go to the first scenario. Information given. Just put some examples here. Like, for example, it could be as simple as bronchiolitis. It could be as complex as cystic fibrosis. Just following the same 6 rules or six point structure. Introduce yourself. Most of the time you don't know the parents, but you will know from the preparation whether you meet them for like a 4 minutes preparation, whether you meet them before or not. If not, just hi there. My name is Dr. Mai Ali, or my name is Dr. Blah blah. I am the pediatric registrar, and I'm here today to talk to you about blah blah. You need to be clear about the purpose of your talk, okay? In preparations of just saying what you're coming to talk, you could actually say, I'll make sure that in the coming few minutes nobody would interrupt us. Do you need anybody to be around with you? Okay, just adhere it. Just take it as a way of practicing it all the time. You'll find it really easy to do it if that's what you're practicing before the exam. Recapping informations, that's really very important in the information given session. So what do you know so far about diabetes? By the way, I'm a diabetes clinical fellow, so everything will be about diabetes. But yeah, what do you know about cystic fibrosis? Did you hear about it before? Where did you hear about it from? Or you don't really need to ask that much. You can just say, did you hear about it? What do you know about it so far? Okay. Deliver the information. You can sometimes illustrate. It could be a bit difficult if we're running the exams virtually nowadays, but try to be factual as much as you can. You don't need to dig your mind at that very moment and ask about getting like exact numbers. You can always depend on open statements like it's by evidence, it's medically evidence that patients who are having this sort of conditions are doing better when starting medications and being compliant with it. So these are nice open statements which are right, okay? Try very much not to say, not to put yourself in a position where you are committing yourself saying numbers which could not be right, okay? If you know for a matter of fact that this number is right, and no matter what, this number is absolutely right, you can always say it, that's fine. But if you're not sure and not exact, don't say it, okay? Don't commit yourself to a mistake. It's always about saying things that you don't need to say, which would take you off and like put you in an like hopefully not like in a failing category or bare fail scoring, rather than not saying something. If you don't say something, that's always fine. You would always say, there are loads of things to say. I'm not going to be able to say it in a coming few minutes, and that would just tick you the box. You don't need to say everything, okay? Reiterate, as we said, number 5, make sure that they understand what you have said, even if it's only 2 sentences, okay? Wrap it up, okay? As we said here, sorry, in recapping, after you say, you ask them, do you know, I would like you to tell me what you know so far, and please feel free to interrupt me while I'm talking. Then that would give you a tick box just for getting them involved while you're talking, while you're delivering information, okay? Reiterate, as we said, know what do they understand, check their understanding, then summarize up everything. And signpost, don't forget. Plus, offer further sessions. Unfortunately, I couldn't ask you guys if that's clear or not, but do you want to just make like thumbs up or something? I couldn't see the chat box as well, but Fatima or Rhoda, do you want to tell me if they're happy, if the candidates are happy for us to move on? Wonderful, thank you, Sarah. I'll move on then. Breaking bad news. Okay, just following again the same structure of 6 points. Introduce yourself. Again, we need to know really well in this scenario whether parents know us already or not, because it could actually be that you are the doctor of this patient and they actually know you every day, but it's just a matter of like telling them new information today. So introduce yourself, name and role as appropriate according to the scenario. Prepare. That's the most important bit in this scenario. Always prepare. Make sure that they've got the support they need. If it's another thing that we can sometimes miss, if it's, I would say, if it's a mother, don't tell her if you want your husband, because maybe she doesn't have a husband. Just be careful about these ethical considerations. Just always say, do you want your partner with you? Do you want someone with you? That would be even better. Then after that, say to them, I'll make sure that we are having a dedicated time for us, and the purpose of the talk. I know it's going to be harsh to say, we're going to talk about your son is going to die in the, no, we're not going to say that, but we're saying, I'm going to talk to you today about what we think will happen, or what is the progress of your child, or what we are seeing the come to discuss more about your child's situations. That would be a better and open one, instead of just breaking the bad news in the first few seconds. Okay.
10 minutes.
Okay, no worries. Breaking bad news in general, the parents can see the child, or if it's the teenage, you can see that she's deteriorating or not going the right way. So you could always ask them, what do you think so far? What are the possibilities that you think, what you're thinking of? Do you want to share that with us? And just, I'm going to tell you some information today. It's not going to be the whole thing, but just please feel free to interrupt me and speak in chunks. Believe me, you don't need to say everything in one session. Okay, just make sure that they understand what you say. There is, in a reiterate point here, there's a place to pause. Make sure that you pause as much as you can. Don't worry about that. Don't make it very long pauses just because you don't have that time. But make sure that you're giving them a time to cry, to vent, to shout. It's their right. It's a shocking information coming into them, and you might be the first one to deliver it if they didn't think about it before. Then wrap up and offer other sessions. Leaflets if that's appropriate. If not, then just other sessions would make it. For some of us who loves mnemonic, just like myself, this is a nice mnemonic for breaking bad news, setting up perception, invitations, knowledge, emotions, and strategy and summary. But if you look at it, to be fair, it's more or less like our structure. So don't get distracted. Management and treatment, as we said, that could be either scenario where the parents are not happy with the management plan, or the patient is not happy with the management plan, and they want to know, why are you wanting this specific procedure? For example, lumbar puncture. Why are you looking for steroids inhaler while my child actually would get more side effects from the steroid? So you need to dig that further. Okay, and it could be just a simple escalation of management. So a child needs actually to be embraced or to go to another hospital. So you need to say that. Introduce yourself, prepare as usual, recap, make sure to understand the root cause analysis or the reasons behind their fear, because that would help you and will guide you towards the rest of your examination, your session. Deliver informations, just make sure that you're delivering what they need to know. You don't need to say all the side effects of the steroids, because nobody's asking you about that in the moment. And we're not checking your knowledge in this station, believe me. It's basically knowing that you can handle those parents, and it's very okay not to know the answer. You can always refer to your consultant, or I will go know more about that, talk to my seniors, and come back to you in a further session. But for the main session, do you understand is that clear? Is that so far fine? What do you get so far? Is that making sense to you? And then just reiterate understanding, offer further sessions, and wrap up. Sorry, I'm just trying to be a bit fast, but you can see now what I mean. It's in general the same 6 points in each session. It's just about the bold points that I'm putting them, what makes it more important to enhance or to address in each of those stations. Conflict resolutions, introduce yourself, prepare, why am I here? It's very important. And again, if you are in a conflict scenario, for example, the parents are not happy about something, or they are just making a quarrel, or not just not happy about something, they just shouted on a nurse face, or the administrative staff, you'll want to know. So I'm here, I understand that you've got some concerns, can we just discuss more? Can we say, you don't really need to say to them, do you need anybody around with you in this session, isn't it? So that's what I mean, that you can actually adjust it according to the scenario. You can always say, yeah, let's make sure that we're not interrupted in the coming few minutes, but I just understand that there's something that you're not happy about, some of the stuff going on here. Do you want to tell me? Do you want to share that, please? And that's where the recap comes. Deliver. You can always apologize. Don't apologize as in you are the mistake. Don't take the blame for yourself, but apologize for the situation. Make sure of that. Reassure them if that's appropriate. For example, if they're long waiting list, you can say to them, well, I can tell you that your child is actually doing fine, and that's really very good. Never use the word, we are actually overworking a word, we are having loads of patients to see. I know that's true, but just don't use it, okay? Just tell them that, okay, the good thing about it, that your child is now doing fine. I know the waiting time could actually be, so you could actually say the same thing in a different way. You can just paraphrase it. Instead of saying we're overworking or we are overloaded with children, you can say to them, we are actually seeing the patients in a bit of a longer queue these days, and therefore we are having a prioritizations to children who are really unwell. Now, the good point here to raise is that your child is actually fine from that point of view, as in he's breathing, his main signs are fine. So that, and again, the gesture and the way you're saying it makes the big difference. Because if you said, well, actually, your child is fine, you don't really need to come here, you don't need to bother, that doesn't make sense, isn't it? And it will just end up escalating their emotions, just getting worse and worse. Ensure that the team, that we as a team are looking after them. So even how silly and how stupid could be the conflict or the reason for them getting sad, don't undermine it, because for them it's loads of things. They might maybe they left their autistic child at home and they're actually in a big deal staying this 1 hour, while you think that, oh well, look at the other one, they're staying in a queue for 8 hours and they're not even nagging. So it's not about the situation, it's about them. Okay, and in real life, it's about them at the end of the day. If they're still not happy, always signpost them to PALS, which is the Patient Advice Liaison System. And I would actually adjust or advise that you would always signpost them to the Pulse team, whether they mentioned it or not, just to tick the box. Okay, but that's not happening in all the cases. Check their understanding of what you discussed together. Wrap it up. Okay. Medical errors, again, either the parents are aware of what happened or not. In that scenario, if they are not aware, then that would be even a bit more complicated, because it's going to be like a breaking bad news plus conflict resolution. Okay, again, introduce yourself as appropriate, prepare them for the scene, really important to make sure that no interruption here. The purpose of your talk, I'm sorry to say that some mistake has happened. You need then to listen actively to them, to hear their concern, and if not, if they are not aware, then you need to say what sort of mistake happened. Again, as a sort of information delivery in this case, you need to make sure if their kid is actually fine, and that's usually the case. I don't think you're going to be mean to get you an example where the child ended up like dying or something. No, I don't think. I think they will end up giving you a case where, like, for example, gentamicin overdose or something, where the child actually is doing fine. So you could always use that as a point in your information delivery, that the good thing to say that your child or your boy or your baby is now doing fine, and then just mention the steps that are meant to be done, clinical examinations, bloods for investigations, whatever. Then ensure that you're following their answers, following the questions, picking up on answering them as appropriate. If you feel that it is too much to say and to answer, make sure that you are addressing at least all the questions, and there might not be enough time today to answer them, but I'll come back to you very soon with my consultant or with myself or alone and talk to you about it. Again, pulse is very important to mention here. Sorry, I'm just getting a bit harried up, but I'll go through another 2 scenarios. Teaching a colleague. Here's the only situation where you don't really need to worry about using medical terms. Okay. Again, make sure you know your colleague before, or this is the first time for you to meet them. Purpose of the talk, that's actually straightforward. You don't really need to say we are not going. You can say we're not going to be interrupted or something. I'm going to talk to you about that. What do you know about it so far? Why are you interested in knowing about it? Is it from a case you saw? Is it your supervisor who asked you? What really makes you want to know about that? Okay, then talk about it. Again, you don't need to say anything. You don't need to be a real teacher in just 7 minutes. Okay, just show them that you know the skills and the idea about how to explain something. Okay, so just a general concept really about it. Recap their information. It's really very nice in this scenarios. I can see just to ask your colleague, like the student or whoever, your senior, your junior colleague, to say back whatever you said. That would give you a bit of the time to say thank you very much. That looks like you're doing really well, and you're picking up really very well. I would say that we need to have another sessions. In the meantime, you can look at this for example, this website, or you can look at this book, this textbook or whatever. And I'm going to come back to you. You just please prepare your questions and we can have another further meeting, or we can do that practically next time maybe and see a patient and so. Supervision. Now that's putting yourself as a supervisor or like a senior colleague where you are advising your junior. Again, more or less introducing yourself according to the scenario or to the preparation that you'll be given. Check the progression. Check how are they doing, and that's really important, I would say, because for example, if the preparation of the scenario tell you that this doctor has actually been late every time in the morning, you need to make sure that everything is all right with him. So it's really nice point to check earlier, even maybe before telling them what you're coming to do. But it will be nice to say, how is everything going on in school, outside school? Everything is all right? I hope everything is okay. So I'm here today to talk to you about some concerns that we noticed as a team has been going on. And we just want to make sure that we are supporting you throughout your work and your career here. We just noticed that you're being a bit late or something, and so on. Make sure you understand from them, because sometimes you could actually offer a vital support that would actually rule out the problem from the first beginning. Sorry for that. So you can actually do you could actually help them in getting the conflict, or you can help them resolve the whole issue. Okay, and then just reiterate back again what do you want to understand from them. Give them, so in the delivery place, in the delivery of information here, in number 4, what you can do, you can actually ask them to about some solutions, and you can actually start to agree together about some solutions. Sometimes it could be really, really complex and you can't really agree about the whole things, but you can have at least set up some points that you would agree about. Check that everybody's happy about that, and just wrap it up at the end and summarize it. Okay, so that's really a general point about the 7 common scenarios. They could just be rolling around them, they could just be rounding around those 7 scenarios. Could be a bit different, but yeah, in general that's what it is. I'll leave the floor now for Fatima and Rhoda to take lead on the scenarios. I'll mute myself.
Thanks, May. It was really interesting and very nice approach. I hope all they enjoyed as I enjoyed. Do we have any question before going to the scenarios? Okay, just my colleague just popped on a message in the chat regarding the feedback. Please, everyone, participate in the feedback, and then after that, you can have a certificate for attending this session.